Every tooth that make up your teeth within every human being is more valuable than a diamond, is it not? Well, be true to them and they would never false you. Today, the Medibus TV camera crew is at the premises of the American Dental Clinic and I am in conversation with Dr. Hala. Hello and welcome to the show.
Hello.
Hello, Dr. Hala. So, the Medibus TV camera crew is here at your premises and the viewers of the channel would like to know all about yourself. So, please tell us something about yourself.
Thank you for hosting me in the show. My name is Dr. Hala Al Sakka. I graduated from the University of Western Ontario in Canada. And I have done my postgrad education in University of Minnesota in the US in hospital-based dentistry. And then I've been practicing in North America for several years, also in Saudi Arabia and in the UAE. That's where I'm staying for the past 12 years almost.
Well, Dr. Hala, you have been in the industry for 15 years and you've served in different countries like the USA, Canada, and you were here in the UAE. In fact, you were there at Saudi Arabia as well for quite some time. So tell us your experiences serving your profession in different parts of the world, which we mentioned.
Practicing in a different part of the world also, it has enriched my experience on several aspects, knowing different type of people on a social level, also on dentistry level. So my experience was in Saudi Arabia was very amazing, also in the UAE, also dealing with North American standard in dentistry, which is one of the highest standard there. So it was like a complete, comprehensive, I would say, experience that make me more multinational person when it comes to dentistry and interrelationship with people.
Well, Doctor, you have been with the armed forces previously before coming to the UAE. So the viewers would like to know your experiences of being with the armed forces. How did you get there into the armed forces and your experience?
Working in Saudi Arabia is one of the rich experience that I had, especially in the Armed Force Hospital. It was a very distinguished facility that has the highest technology, and I have learned a lot and added to my experience, and addition to more discipline being in an army,
Absolutely. Well, Doctor, we have heard that you won several awards and acclaims. So if you could just enlighten us with the various awards and acclaims that you have received until date.
I have a special passion for cosmetic dentistry, and that's why I have participated in several contests when it comes to best conservative cases. Conservative means that the minimal amount of tooth structure you need to remove in order to change people's smile from before to after, and that will really add value to the people's life at the same time. So I have won 3 years in a row, actually, the best award in conservative dentistry and in the multidisciplinary approach, where I had to deal with other specialists with me to help me on a case, and the prosthodontic case also.
Congratulations on the same.
Thank you.
Well, Doctor, tell us something about the American Dental Clinic, your team, your core strength.
Well, I'm happy that you started with the word team, because I really believe in a teamwork approach and everything as a base for success. One of the good things that we have in this clinic is that teamwork and the like a second family. This is really important, that people care about each other in one direction. The other thing is we have the interdisciplinary approach. Interdisciplinary approach, it's not actually it's kind of, people know that, but they don't know exactly what it means, and that will make us a little bit different than other places in the world. I'm sure there are other places they do that, or maybe better, but what I'm proud of is I look at my patient and I like to educate my patient when they come with the best possibilities, options that they can have to achieve the best they can need, that I provide, or my team also, other specialty that can get into the way also. So we all of us come up with the best option. So it's not like one way to do something. The patient has the right to know what are the best option that you can have in this clinic or maybe somewhere else. However, after establishing the nice rapport with the patient and the trust, you can choose the best treatment planning. So that's what we call it multidisciplinary approach. We are at the American Dental Clinic. We have the best state of art when it comes to dentistry, best technology. We have just strive always to take so many courses, different part of the world, even all over the world. All of us, we do that in order to see what's going on in the market, what's the best, how we can serve our client better. In terms of orthodontics, for example, now we have the Sure Smile technique, which is like a special software that has cut the time needed for the conventional time you do for orthodontic treatment that take around 2 or 3 years to half of the time through special Microsoft. And we have the Envision Smile also that can show you your smile, how it's going to be before and after. So at the end, you will not be surprised how it's going to be. We have the CAD-CAM system also. This is very important because before, patient used to be bothered by you taking impression, making temporary, and they has to wait for a week until he come back for a crown or bridge. Now through the computers, through the scanner, you can scan his the crown and then finish it in less than a day. They're still working on maybe the quality when it comes to aesthetic and function, and companies are actually competing to provide the best, and we are trying to be on top of it to see what's the best and durable and functional and aesthetic for the patient.
So you frequently upgrade your information and knowledge and technology and so on.
Always. I've never trusted a material before asking about it. So we have like our association with our clinical research, American Clinical Research Association, that they have no profit. These people, you can send them the name of the product and they will send you the data, what they think about the success and failure and where it has to be applied or not applied. So we spent quite, whatever I like to apply to my teeth or my family or myself, I would do to my patient as well. And this is the feeling of everybody here.
And as you said, team is everything for you. You would rather prefer to say, let's go rather than go.
Absolutely. I told you, I started with the word my second family, that's really because I feel like I'm at home, all my assistant or everybody here, the doctors, we just one unit because we have like one team and one goal.
Well, doctor, what are the primary the dental hygienes that you should follow? The basics people would like to know to protect your teeth, to help your teeth survive the best in its manner.
The most important thing in dentistry is prevention. So if we all start from prevention, that will avoid actually a lot of unnecessary visits or, how people, they don't like to be at the dentist chair. Prevention comes from very simple technique by starting visiting the dentist at such a young age, I would say from 3.5 to 4-year-old, where the child will get used to sit on a chair, so he will not develop the fear of seeing a dentist. And also the adult at the same time, they come and see the dentist for every 6 months to a year time. Because some people, they're gonna wait until they have pain before they come and see. And then since they don't have pain, they assume that they don't have any problem. However, through the technology of the X-ray, which is a digital X-ray that has minimal exposure to radiation, we can find out if there is any small thing started to develop between the teeth and alert the patient. And we have an excellent hygienist at the same time. She will do thorough cleaning for the teeth to get rid of the bacteria, the plaque, the tartar that build up because of the saliva, and add fluoride to the teeth. For children, we add also sealant to make them stronger. So this maintenance program that we have for our patient make them feel at ease, that been taken care of, and from any other problem that might occur.
How many times do you have to brush your teeth?
Twice a day is fine.
Twice a day is fine.
Flossing is very important. Unfortunately, I know it's difficult. However, now they have this air floss thing that you don't have to go with the floss between the teeth. It's simply air that goes in between the teeth and clean it. Because even if you brush the outside surface of the teeth, still the space between the teeth is closed. So you need to go with the floss to reduce the plaque from there. Once daily, it's important, and the best time, I think, before you go to bed.
What is your take on using mouthwashes?
Yeah, mouthwash is fine also. It reduces bacteria at the time when you use it, especially before you go to bed, as I'm saying, because at that time when you're sleeping, that's where the pH of the mouth become acidic more, and that's where the bacteria become more active. So if you use the chlorhexidine, for example, mouthwash that kills over 90% of the bacteria, it helps a lot to prevent having problems associated with gum disease, periodontal disease, or teeth problem.
Well, doctor, we would like to know about, I mean, you would have had several experiences with several people over the 15 years of your tenure in different parts of the world. So could you highlight any one experience that always enlightens you whenever you travel or speak, or whenever you share your information with your friends, colleagues, and so on? One experience which you'd like to highlight to the audience of MedDS TV.
Well, every day in this practice, you have unforgettable experience, because basically we are dealing with so many patients, with so many people, and all that. One of the striking one that I still remember it about that girl who came in, and she was extremely desperate about her smile. She's a young girl, and then she just thought, and she consulted, and she thought that there's nothing could be done to change her smile. Now, with minimal invasive technique, I would say very conservative technique, I was able to do a transformation for her. I wish I can have the time to show you pictures maybe later. I'm very proud of this case, and how it changed her life dramatically. And then how far she was thrilled, and also I was thrilled because I won the first cosmetic dentistry award in Middle East and Africa.
Well, doctor, the common layman, they are not aware about treatments which was done 5 years back or 10 years back, and the treatments now. With the entrant of the new equipments, with the entrant of new knowledge, new people, the new findings in the market, and so on. So, if you'd like to highlight about past and present as well, and the future, what's going to come in the future as well.
There are a lot of improvement when it comes to dental materials.
Okay.
So the expectation and the outcome of what you can get it's a lot higher now. They have, for example, if we're talking about the veneering or crowning, they have found the best material that can be so durable and aesthetic at the same time. The other thing also I would like to highlight is the conservative approach. Before they used to, for example, crown more teeth in order to provide nice smile. Now they're trying to go more conservative by doing the thin layering of veneering that you can add it to the tooth without prepping the tooth. And of course that does not apply to everybody. If teeth are, for example, overlapped or in a so much projected position, then you cannot do that. But instead of cutting on that tooth, you can also have braces done for these teeth to align them properly, and then they can have the least possible treatment with the nice veneer that can give them the very natural, nice white appearance. Implant dentistry is also one of the conservative technique, I would say. Although some people, they say, oh, it's a surgery, or I don't. No, but I mean, if you're losing a tooth, it will not make sense that you go to the tooth in front and tooth in the back and damage these teeth to make a 3-unit bridge component. This is an approach, and that's maybe it's been done for years and years back. However, now tooth structure is very important to us. If we don't have to remove from it, we try not to. So implant dentistry provide that, because you will be applying this implant in between those two teeth without touching the adjacent teeth, and also you can have better hygiene and flossing and cleaning in between.
Well, doctor, tell us something about your association with the international entities.
I'm duly registered with the Royal College of Dental Surgeons of Ontario in Canada, which is representing my licensing to practice dentistry in Canada. And I would like to, Canada for me is a second home at the same time. And that's where I practice dentistry whenever, if it happened, if I go back and forth between the two places. I take a lot of courses and make sure to maintain that registration. The other association is the American Academy of Cosmetic Dentistry. And I travel to the state a lot because they really focus on that cosmetic and the state of art when it comes to the best approach to produce the brighter, nicer smile. So, and the academy itself has their own annual meeting that they meet every few years, and then they will be talking about the best technology and the best invention and the best approach to help the patient the best.
Doctor, could you throw some light on the hospital dentistry as a whole?
I was a resident at the University of Minnesota in the US. Had a training in hospital dentistry where I used to see patients in their general anesthesia. And that gave me the privilege of hospital practice in the UAE at the moment, where I can see patients in Bellhole Hospital, American Hospital, and the general anesthesia. It's basically mainly because of the children who cannot tolerate normal setting because of their age. Some of them, they will be having some health issues that they will not be, like Down syndrome or other stuff that they cannot be tolerating dental setting. There are some medically compromised patients or some adult with phobia that I had some time to take them in the general anesthesia. But I mean, it had added so much to my knowledge in dentistry because you are in contact with the physician at the hospital and then see what you can deal from health point of view and teeth point of view interaction.
What are the prerequisites that one should take to have healthy teeth, a nice smile, and a good outlook?
The prerequisite for that is the right diagnosis for the case.
Okay.
The right diagnosis, that means you have to know exactly what's wrong with the smile. Like sometimes they come to you and they say, okay, I want to look like Angelina Jolie, for example, or I want to look like that person. Everyone has his own specific or specifications when it comes to their smile. And to keep that natural as much as possible is really a skill. You cannot have everybody the same teeth, the same length, the same height. It won't look nice. So you can tailor it based on what that person will be the nicest size and dimension of the teeth for it. And there are golden rule that also we follow how the rest of the incisor or lateral or the canine has to be. There are different types that we can show them. Some people, they want them slightly overlapping, doesn't have to be straight, perfect. Sometimes imperfection give more attraction. And then we will do something called a mock-up. Once I know what the patient wants, of course, you have to make sure the teeth are clean, no cavities, and we do x-ray and all this. And then I'll do a mock-up. Me and the lab, we'll sit together and then I'll be in dimension writing for them what I think the nice width and height of the teeth based on the smile, based on the gum line. There are so many into it. And then we come up with a fake one that the patient will be placing in. We call it a mock-up. And then we take smile photo. And then he would see, oh, I like it. I think it's long. I think it's short. Maybe we should do this. Maybe we should do that, And then we come up with a treatment plan. But the nice thing about this, although it's a bit lengthy, and also I take into consideration the occlusion of the teeth, because sometimes you might provide teeth and the patient grind them, might break them. So if you are looking at comprehensive thing from function and cosmetic, then you can do a durable long-term work with a, with no failure. And at the same time, at the cementation visit will be no surprise for the patient that I like or don't like, because you walk them through it and they know what to expect.
Thank you for your time. It was nice speaking to you. Lots of information shared from your side that will be beneficial to the viewers as well. And the next time we see you, we look forward to see you in greater heights with more awards and acclaims and great heights.
Thank you so much. Thank you.